ED. That's right, erectile dysfunction. That's what we're going to be talking about today. And there's a few things I want you to know. First of all is, if you're watching this video, don't be embarrassed. And if this is something that you struggle with, please know you're not alone. Trust me. And finally, don't shut off the video because we're going to talk about a lot of important things about ED that you need to know. Hey guys, welcome to my channel. I'm Dr. Jennifer Caudle and I'm a family doctor, and I talk about a lot of health news that you can use on a daily basis, and I also talk about a lot of quirky health stuff that, stuff that you might have always wondered about. So if you're interested in either of those, please make sure that you hit the subscribe button and the little bell to make sure you keep getting updates. So we're talking about ED, or erectile dysfunction, and we've already laid the groundwork, right? We're not going to be embarrassed, we're not going to feel like we're alone, and we're not going to shut off the video, right? Because there's a lot of great stuff to learn. So ED, or erectile dysfunction, is a problem getting erections or maintaining erections. Now, the first thing that I need you guys to know as a family doctor myself is I know I don't, and I know my other colleague doctors, we don't ever want you to feel embarrassed or ashamed coming to talk to us about this condition. However, I know and we know that often you feel that way. We know that this is a touchy subject. We know it can be embarrassing. You can feel self-conscious. You might feel like you're being judged. You might wonder what the doctor is thinking. But I just gotta lay the groundwork and say, first of all, your doctor should be a safe place for you. Your doctor should listen with open arms and with open ears, and ready to help you with your health issues. These are medical conditions. To me and to my colleagues, we think of these just like we do diabetes, high blood pressure, high cholesterol, all sorts of other things. So we're not looking at what you're coming and complaining of, and we're not judging you. We're not making assumptions. We're not thinking about this in any other way than as a medical condition and how best to help you. So please feel comfortable telling us how you feel and what's going on in your lives. That's the most important thing. And by the way, if you have a doctor and you feel like you can't tell them what's going on, you're just not comfortable, well, you know what? You have Dr. Chen's permission to find a new doctor. Okay, had to get that off my chest. Let me tell you about why it's so important that you tell us about ED, okay? Now, yes, of course it's to fix it, right? And make it go away. And we can do that, right? That's actually not the problem or maybe the biggest deal. We can fix ED in many, many cases. The more important issue is ED, or erectile dysfunction, can actually be a sign of other underlying medical conditions. Yeah, that's right. So when you're telling us about your ED, we're listening and we're thinking about what we need to do, but we're also, as doctors, thinking about, are there any underlying conditions that could be contributing or causing the ED? So what are these conditions, you say? Some of the more common ones are high blood pressure, diabetes, that's a big one, heart disease, and something called okay. Let me try that one again. Something called atherosclerosis, or hardening of the arteries. It's when your arteries kind of get built up with plaque, they get hardened and things like that. But guys, that's not it. Sometimes ED can be due to something called low testosterone, or low T is something that we see on TV. It's sort of advertised that way. So yeah, that's super important for us to know about. There's also other things, other medical conditions or medical procedures. And you know what? There's actually some medications that can contribute to ED. Another reason why we really should know if this is going on in your life, because we may need to stop and take a look at your medications and switch things around. Also, guys, alcohol and tobacco. Yeah, alcohol use, especially excessive alcohol use and tobacco use, they can contribute to ED. Just another friendly reminder to drink in moderation and to please don't smoke. And finally, a big cause of ED, believe it or not, I don't know, you might find this surprising, is things like anxiety, depression, and mood disorders. And in fact, a lot of men have ED when they're having relationship problems with their partners. So how you're interacting with your partner, how you're feeling on your own, your mindset, your mood, all of that matters. ED can actually be a sign of other health conditions. So make sure, if you haven't found a doctor that you love and that you're comfortable with, keep looking till you find that doctor. But please don't be embarrassed or ashamed to tell us about what's going on with you, because we really want to know. Thank you guys so much for watching today. I'm Dr. Jennifer Caudle, a family doctor. And again, if you want more health news that you can use on a daily basis, or if you just want to learn about lots of quirky health stuff, that's the stuff I'm always interested in. Please make sure that you subscribe to my channel. Just subscribe up there and click the little bell to make sure you get updates.